So, Rebecca, you got a question for me.
Yeah. A client came with this question for me, and I had part of the answer, but I thought you would have a better answer. So their question was, someone I know was arrested. Instead of going to jail, they went to Western State, a psychiatric hospital here in Steilacoom, Washington. Is that something that just kind of happens? And I was like, no, it's really hard to get into Western State. So I did a little research. Of the 24,000 people that are incarcerated in Western State and Washington State, there's only 800 beds at Western State Hospital.
Yeah, they're expensive.
Yeah. So that's like 0.3% of the incarcerated population is there. But I wanted your thoughts because I know that's something that you study in
forensics.
Yeah.
Yeah.
What's the process to get someone to admitted to a place like that?
Well, there are many vectors, but it sounds like with this individual, they were found maybe not fit for the regular detention centers because of a psychiatric issue. Is that what it was?
Yeah.
Yeah. So that's one vector. Another is that you're found insane at the time of the crime, or you don't have the capacity to stand trial because of a psychiatric, usually psychosis, right? So those are typical vectors to get you into Washington State Hospital.
And like, how many professionals would evaluate you?
Oh, in my head, anecdotally, with the limited experience I have, it's 2 or 3 by the time you're actually officially incarcerated, because you have the initial evaluation, and then there might be a trial, and there might be another evaluation. And if it's a trial, then you might have evaluations from either side, plaintiff and the defendant. When you're in the hospital, you're probably going to have another assessment by the on-staff clinicians.
But this isn't something that would just kind of, whoops, like they got put over here.
Right. I mean, generally speaking, the system, by default, they're trying not to put people into the psychiatric hospital because it is so expensive and so particular. So if anything, people who should be there aren't.
Yeah.
So if someone is there, generally speaking, it probably meant that it was called for.
Yeah.
But that isn't a guarantee, especially if it's just for a week or two. Like you could have someone who's tweaking from meth and having a psychotic break related to that, and it's temporary. And once they're sober, then they no longer suffer from psychosis, and then they're released. Or it could just be one night of PCP or something, and the evaluators just don't know what to do. And so, it just kind of depends. Yeah.
Yeah. Well, it was an interesting conversation of, kind of this person has been manipulative in the past, and how manipulative can they be of the system? And I was saying from my experience, not very. Like, it's a pretty structured system with lots of evaluations. And
Yeah, these people have dealt with manipulative people before.
Yes.
And also, even if it was a manipulation, there's a false notion that somehow a psychiatric hospital is a better incarceration experience than other options, which is not true. It's still jail, and there's pros and cons, but it's not like in Washington State Hospital, you're sitting around in a kumbaya circle talking about your feelings the whole time. It can be just as, if not more, frightening to be in, because these facilities often are underfunded, and there aren't enough people that can intervene if someone has an episode or something. And these people are incarcerated, so they raped and killed and murdered and molested. These aren't people that you like hanging out with in close proximity in either detention center. So, this notion of, they got off on it, insane at the time of the crime. It's like, in a lot of circumstances, it's a worse sentence because there is no limit to the sentence. If you're not found to be insane at the time of the crime, you might get, say, 5 years. But if you are found to be insane at the time of the crime and are incarcerated and are not found to be sufficiently recovered from your disorder that likely led to the crime, then you could be incarcerated for the rest of your life, because the psychiatrist who is in charge of recommending discharge will say, no, he's not ready. I'm not confident that he is sufficiently on board with treatment or symptom-free to be on the streets. Whereas other crime, if you're incarcerated in the regular route and it's 5 years, it's just 5 years. There's no person at the end that's just like, no, I don't know if he's ready to be released. So it's in a lot of ways a worse outcome for people. Now, having said that, there's a lot of treatment and a lot of good things that happen, a lot of understanding. So if someone is suffering from psychosis, then it is the better option, of course. But
yeah. Well, thank you.
YouTube member Ina, she wrote in and said, love your YouTube channel. I've been listening for years now, and it is all that I consume from YouTube for many, many years. It is all that I consume from YouTube for many, many years. Well, YouTube member Ina, there's a lot more things on YouTube.
Yeah, there's Nate the Hoof Guy. There's Never Too Small.
I can't watch the hoof. Some of them I like them, but there was one that was going viral the other day, and it gives me the willies. I like that these horses are being tended to, but
this is a cow. I like the cow ones.
Okay.
They're a little different.
Okay.
I'm a connoisseur now, and I can say the cow ones are different than the horse. The horse ones tend to be more extreme in the neglect kind of way.
Uh-huh.
At least the guy that I watch, and the cow ones are more like daily maintenance, not daily, but like, quarterly maintenance, but something went horribly wrong.
Okay.
Just so you know.
Good to know. Ina says, thank you for all your hard work. It helps in so many ways. My own therapist said that breastfeeding on demand for my 18-month-old is wrong, and if it needs to, it should happen only as an aid for sleep. She says the toddler should learn other soothing mechanisms and breastfeeding whenever she wants to stop that. She says that toddler should learn other soothing mechanisms. And I realize this is not your specialty, but I do reality trust your judgment and knowledge. Are these studies that endorse her claim? What do you think? There's, obviously there's English as second language from YouTube member, which is fine because I don't speak any other languages besides English, and I barely speak that. So
I got it. I know what's happening here.
Okay.
So I would have no problem with somebody breastfeeding on demand of a 18-month-old. If you want to check out, in America, it's the La Leche League. Has tons of information on breastfeeding, but that's still a baby, and it needs comfort. And all over the world, people breastfeed on demand until way later than 18 months. So if you're okay with it and your baby wants it, then please continue on.
Yeah, absolutely. Do you remember I think it was Time magazine had a cover of a woman who was breastfeeding her 7-year-old
Yes.
or 10-year-old, or I don't know. It was past the typical weaning age. And it was such a big deal in our culture 10 or 12 years ago that the local radio station, Cairo, asked me to come on and talk about it on a panel of experts. And it gave me a chance to look up the research and give it some thought back then. And I had already come to this conclusion anyway. I mean, this isn't really a question that comes up very often because I feel like most people have enough resources or figure it out on their own somehow. But the thing that I'll say is that, particularly 18 months, I mean, that's totally fine. Now, you're going to get some reactions past that point. If you're past 24, past 36 months, you're going to get some looks from people. I wonder what the exact cutoff for people is, or what the general cutoff for people is, just, how society would see it. But in my head, I feel like it's when the kid is speaking and communicating fairly effectively, then I feel like maybe that's when it starts to feel queasy to some people. But there's nothing queasy about it. And as you said, when we look around the world that doesn't have all the body negativity and sex negativity. I mean, literally, the reason why people are uncomfortable with it's because it involves sex. And it's like, it doesn't involve sex, you fucking pervert. Like, it's the most natural fucking thing. It is the original thing of life for humans. And when you look around the world, then that don't have those issues, I mean, they have their own issues, but not that issue, then you see a wide variety of practices. So it's, it also is often a misunderstanding of how a 36-month-year-old or a 4-year-old will breastfeed. It's not like they just sit there for hours.
It's
usually
like a minute or two.
Right. Yeah. It's just like self-soothing or bonding or habit for both people, you know? So it's, and eventually kids naturally just stop wanting to do it, usually. Now, sometimes there is something going on, like the kid doesn't have other ways of soothing, or there is some kind of power play some kids will engage in. I mean, any mother with a baby will say that at a certain point, there's a lot of nuance to the relationship around, because, you know, there's sometimes when you're just not into it or you're busy or something, and the kid will get a little ornery about it, and you know that the kid doesn't need to breastfeed. It's not like the kid is desperate for calories or something in this moment, but in the same way that a kid might want to be picked up and you just don't have the time, it's a similar thing. So you can have a 4-year-old that can be invading your space in this way. So, you know, it gets, you know, complicated, but to have an 18-month-old, particularly 18 months, I mean, I just find, and so I wonder what this, so my own therapist said that breastfeed, I'm just wondering, how does that come up in therapy?
Right.
Like, why
or
is the therapist even
in what
commenting?
way is the child expressing distress that the therapist is concerned?
Right.
Because, I mean, also the brain development at that point, the primary parent is that child's whole world.
Right. So it's, you know, understandable. And it's not only understandable, it's a beautiful fucking thing. It's a beautiful thing for a child.
And child images, I mean, all throughout every culture has an image of a mother holding their baby, suckling their baby. Like, this is, you know, this is the thing that makes us human in many, many ways, is the ability to connect.
Yeah.
And I will say my kid self-weaned. So I'm doing the sign. So if you squeeze your hand, this is the sign for nursing. And this is the sign really early they picked this up. And so we use this back and forth. And I remember when they weaned themselves at 17 months, and I would like look at them and make the sign, and they were like, nope. And I was like, okay. And then we went on a trip shortly after that, and they got distressed and they wanted to nurse a little bit. And then that was it. They were done. So, you know, it's really a very intimate relationship between you and your child.
Yeah.
And I would not see the need to change it in any way.
Yeah. Don't let this therapist get in the way of, I'm guessing for you, Ina, it feels natural. It feels okay. It feels good. It feels bonding. It feels nourishing for both people. And don't let your therapist ruin that for you. I will say that there's a lot of misinformation about breastfeeding in the world. So it doesn't surprise me that you would have a therapist that doesn't know what the fuck they're talking about things you don't know what the fuck they're talking about. Anyway, especially 18 months. I mean,
yeah, that's so little.
If it was 36 months or 4 years or something, I would still say the same thing.
Is this the same story where the woman drove to the elementary school at lunch and the kid would come to her car and breastfeed in her car?
What, an email?
No, not this email, but the story that you got pulled in to talk about.
Well, it was a whole article on attachment parenting, and breastfeeding was a part of it. Another part was like the kid sleeping in the bed of the parents for a lot longer than is customary in mainstream American culture, you know, instead of putting the kid in their own room at the age of 2 or something. It was a whole debate around that. And of course, when you talk about parenting, everyone has an opinion.
Right. Everyone freaks.
Everyone freaks out. And so, but the cover of the Time magazine was pretty provocative because it wasn't just a candid picture of a mother and her, I can't remember the age, 5, 6, 7 years old. They were posing for the camera. They were, the kid was like on a stool or something, suckling on the breast, and they're both looking at the camera, So it just had a striking look to it. They're both just like, he's on her nipple and looking at the camera, and he's old enough to stand and look at the camera. It was striking, but again, it's fine. And people will instantly think of incest and shit, and it's just like, that's what I was getting to earlier about the perv stuff. It's just like,
this is how people have received nourishment forever.
Yeah. Yeah.
We wouldn't be here if it wasn't for breastfeeding.
Yeah. And not everything has to do with sex. You know what I mean? Just because it evokes that in you is, I guess, okay. But breastfeeding is a fundamental aspect of life. Having said that, plenty of reasons or practices or preferences lead people to not have breastfeeding in their child rearing, which is also fine. Anyway, let's take a break. All right, we're back from the break. I have all these caveats about breastfeeding because years and years ago, I answered an email about breastfeeding, and I can't remember what I said, but I misspoke or said it in a simplistic way, and received received a notable, very memorable email. It wasn't like really hateful or angry or anything, but it was an early email saying what you said hurt my feelings or something like that. And so I guess I'm just making sure that doesn't happen.
And if we want to do the non-gendered version of this conversation, we would call it chest feeding, not breastfeeding.
Okay. Anonymous patron, they wrote in about politics. And I sent this to you so you wouldn't be caught off surprise on this. Caught off surprise?
Off guard?
Off guard. I'm terrible with idioms.
Yeah.
Anonymous patron says, hi, with RFK, Robert, I guess, Fitzgerald Kennedy.
Oh, I never thought about that.
I mean, it's John Fitzgerald. With RFK and others in the administration talking about exterminating autism, vaguely trying to criminalize mental health disorders.
He was supposed to solve it by last September. What happened with that?
Yeah. And opening camps, meaning camps for people with mental health disorders, and otherwise increasing misinformation and tolerance for various mental health diagnoses. Do you think this could make the case for giving people better tools for self-diagnosis? So just chiming in. So they're saying, because of the fascist pseudoscientific.
Fascism, it's so exhausting.
Yeah. Conservative / there's also a lot of like new age in RFK, which is really bizarre. Mm-hmm. But because of all...
I sent you that article that if we just stop drinking... He thinks if we just stop drinking soda, schizophrenia will go away.
Yeah. And the Tylenol thing. Anyway, so what Anonymous Patron is saying is, that because the threat of being thrown in a camp is potentially there, might we actually give people tools to self-diagnose so that there isn't a permanent record of their diagnosis? So going on with the email, self-diagnosis is not very effective or reliable, but it seems like having any kind of official diagnosis on your record might become dangerous in the near future, especially for things like autism and gender dysphoria. I feel like the field of psychology might have a responsibility here to provide people with better tools or guidance towards some sort of way to help themselves without getting any sort of official diagnosis. What are your thoughts, Rebecca?
So I would argue with this person. There's tons of stuff out there for self-diagnosing. Most people come to me pretty clear of what their diagnosis is. So I would say most people who want to be diagnosed by a professional want the services that come with that. And I'm sorry to say that if you want the services, you have to have the official diagnosis. I work with tons of people in the school system in my practice, and they have all kinds of workarounds. But if there's a certain level of services that you want, and you want to be in the system, you need that diagnosis from a professional. If you just want it for yourself and you just think that's what you have, I bet you could probably find something online to kind of self-diagnose. So this is really about the level of acuity. And, if they're coming for autistic people, they'll be coming for someone else in a minute. Like, I don't know if we can protect ourselves from the rate at which the fascists want to label us and take us away. I think of that poem of like, first they came for the Unionists, but I wasn't a Unionist, so I didn't fight. And then they came for the Jews, and I wasn't a Jew, and so I didn't fight. And then, at the end of the poem, they was like, and then they came for the Catholics, and there was no one left to fight for me. Like, they're going to come for us in all kinds of ways. I don't know if not being diagnosed is the only thing that's going to protect us. Does that make sense?
Yeah, the issue is complicated. So, but as you said, that's the issue, in that we wouldn't want to live in a world where clients could come to us and tell us what their diagnosis is to get medication or treatment or something like that. I don't think anyone, and I don't think Anonymous Patron is saying that. Or at least I don't think that's what Anonymous Patron is saying. I don't know. But the issue is the confidentiality around your diagnosis. There isn't a national registry of diagnoses. So the government would somehow have to attempt to get those records. And I'm not saying it's not possible, but it would be quite an undertaking, particularly for private practice therapists, particularly if we're not using insurance, which often is the case. I mean, depending, because like I haven't used insurance for a long time. And although I do diagnose my clients for the most part, I don't have to because I'm not using insurance. But if I do diagnose them, the only two people that know of the diagnosis is me and the client. And the records are literally physical records that are in my office. So they're not even on one of the regular therapy software services that they have, So they would have to send a subpoena or some kind of request to me by letter, I guess, that I would, submit my those records. Now I'm particular, right? So if you wanted to go to a hospital, that'll be a lot easier. If you wanted to go to a particular private health insurance, this is kind of funny how because the Republicans are all about private health insurance. Well, to get the diagnoses of everyone from private health insurance is made a lot harder by the fact that you have all these different private health insurance companies. You know what I mean? Now there's the state insurance, which would be easier to access. But yeah, they could get that. But the gap between RFK and maybe Trump just spouting bullshit at a press conference versus them actually rounding up people who have a mental health disorder into a camp, I mean, that's a huge leap. And if we even get close to that, like,
we're fucked.
Well, no, we're as a society, we will get pitchforks and our guns and we will defend,
Well, but also if you're really worried about this, you're really worried that they're going to come for you as with a diagnosis that you have, go make relationships now with people who are fighting for immigrant rights. Like if you think they're going to come for you next, go fight for the people that they're coming for now. That's your best defense. And I think watching Minneapolis is so amazing. I was just had this conversation the other day. Like, this is the model that the Black Panthers set up for us in the 60s. This is why they were considered so dangerous by the government, because they defended, but they cared for the folks that were most marginalized. And that's the model that we're seeing in Minneapolis. And I just said it once, I'll say it again. If you think they're coming for you, go hang out with the people who are defending who they're actually coming for now, because those are the people you want to learn from, of how to protect your community your friends, what it takes to protect your community. Go get a whistle.
Yeah, good point. I hadn't thought about that. Talking about self-diagnosis is complicated and something that I get asked a lot about, particularly because of the visibility of it on TikTok. And
people can say all kinds of things, right? Like I have this, and you're like, okay, great.
Right. So on the not good side of self-diagnosis, it's obvious what those cons would be. One is that the person self-diagnosing is inaccurate and they don't know what they're talking about. The other is that it can lead to harm. The individual could go down a road or force their clinician or influence their clinician to provide them treatment for something that they don't have, and real harm can happen there, right? It can be really annoying to clinicians to have to deal with people who come very convinced of things prior to
That's always very interesting for me when somebody comes and they're like, I have this. And I'll be like, well, that long process of trying to say like, hey, here's some other ways of looking at this.
Right.
I think you have this, but also there's certain things I can't diagnose. There's certain, like ADHD, it'll take you 2 years to get an ADHD evaluation in Seattle.
Right. So
these are really hard to get.
So that's the pro of self-diagnosis, is that in some circles, in some scenarios, that's your only option. Mm-hmm. In terms of seeking resources, right? If you, for example, have ADHD and don't have the avenue, which is pretty typical, to actually get an official diagnosis from an expert, then what do you do? Especially if you're not looking for medication. If you're looking for tips online or resources, then self-diagnosis might be your only option.
Yeah. And someone just asked me this, a close friend just asked me this recently, like, would it be worth me getting an ADHD diagnosis? And I was like, well, what would you do with that? Do you want accommodations at work? And they're like, no, they've found a job where it's great that they have ADHD. They manage a restaurant. It's perfect. But yeah, it's not going to serve them to be officially diagnosed. They know it for themselves. They can see it. They know how to manage it. Yeah. Yeah,
right. The two main concrete reasons why you would want a quote unquote official diagnosis is accommodations, and the other is medication. Because even psychotherapy, counseling, you don't have to have an official diagnosis, even from your therapist, to work on a lot of things that are very related to ADHD. If, for example, in a weird world where you do legitimately have ADHD and you're pretty sure that you have it and you've quote unquote self-diagnosed and you go to a counselor and they don't think you have ADHD, well, you can just put it into other words. You could just present your symptoms and say, well, I have a hard time staying on task. Can we talk about that? Or I have a hard time in my relationships because people don't seem to understand that sometimes it's hard for me to remember things and I will let people down, and my wife thinks that I don't care about her when I'm really actually trying to do my best, but it's actually kind of hard for me to concentrate or hard for me to remember to put my shoes away or something. And I mean, these are literal conversations I've had with.
I'm laughing with you.
Yeah.
Because it's like I've had just clients who are medicated for ADHD, and they'll say things like, I've taken over the dining room table and the couch, and like my partner's mad at me because they can't use the living room or the dining room. And I'm like, okay, let's deal with that. Right.
And as with anything in a marriage, when you have a request that seemingly goes unobliged, you feel like your spouse doesn't care. That's why they're not doing it. When with ADHD, it's really something else. So, having said that, people with ADHD can be uncaring and selfish. So how do you know the difference? And if the person with ADHD really put their mind to it, right, they probably could tackle this. But like with all of us, there's a matter of priority and how much brain energy you can spend on things. And if you spent your brain energy on that, then you'd have to sacrifice something else. And that's where counseling could come in, couple counseling. You bring people in and have conversations around ADHD or the symptoms of ADHD, how to communicate about just differences, that sort of thing.
Right,
so,
what you can and cannot do.
Right. Now, the other thing I'll say on the pro side of self-diagnosis is I have self-diagnosed many times. I mean, not many times, but some key moments of my life I've self-diagnosed. Not only is that not considered clinically sound, but it's actually unethical because, of course, I'm biased about myself, right? Now, what does that mean, though? Well, what it means is that early in my career, I diagnosed myself with panic disorder because I took psychopathology with Ned Farley. And when we came to the anxiety chapter, I was like, oh my God, I'm not going crazy. I have panic disorder. And then I proceeded to treat myself, which is also considered unethical. But I'm here to tell you that was the best thing for me because I didn't have to pay for it. I knew myself. I'm an expert. I became an expert in anxiety. I didn't have to drive to an office, and I didn't have to spend a lot of time explaining things, and I could do it in the moment, right? If I had a panic attack on Saturday night at 7 o'clock, I didn't have to wait till Wednesday at 11 a.m. to talk with. I could treat myself right then and there. So is that wrong? Is it unethical? Technically, yeah, but I'm here to tell you that it worked for me. I've had PTSD around health anxiety, and my hands are sweating just slightly thinking about that topic. But I have very effectively treated myself to the extent that I can actually go into a hospital now and not faint. So those are all no therapist ever. And even if a therapist did diagnose me, I would have been like, yeah, duh. I'm an expert in it, and I'm also an expert on myself. So I don't need anyone to help me with that. So that's a pro. Now I'm a therapist, but the knowledge that you and I have clinically isn't some magical set of.
No, it's still long haul from diagnose. I mean,
right.
Yeah.
Right, but I'm not giving myself medication. Maybe that would. But
right. There's things we can't do. And that's actually the doctor, if a doctor writes themselves their own script or writes it through someone else for themselves, that's like they'll get disbarred. Or what's the word?
Your license, right?
Right.
Yeah. And I'm not asking for accommodations or anything based on my self-diagnosis. It's all just that. The other thing I'll say is that with some diagnoses, it's not hard to self-diagnose, like with panic disorder or with depression, major depression. It's not hard to read the criteria and say, oh my God. Or if you have a substance use disorder and you're honest with yourself, it's not hard to self-diagnose. Whereas things like ADHD, honestly, autism, these things are extremely complicated diagnoses. It's not impossible for a non-clinician or a non-expert to self-diagnose, but it's a lot harder. And with the amount of misinformation online, there was some study that identified on TikTok that the majority of information on TikTok about, I think it was autism, I'm not sure, maybe it was ADHD, one of the two, or both, I'm not sure, was false, like just patently false. Things, even clinicians were saying things on TikTok that were just completely false, which is my experience. So for people to be misled.
I barely do TikTok at all.
Well, you're on Instagram,
yes.
And you look at Instagram Reels, so you see the same thing that's on TikTok.
But I don't know,
But your algorithm must not be.
Yeah, I see like Italian chefs. I'm like, ooh, look at that pretty bread.
Yeah.
I'm in some different. I guess I just want to say to the algorithm, I want to stay where I am.
Yeah.
Please don't bring other things.
The other thing I'll say is that the hardline notion that is much more relevant in the medical profession doesn't apply necessarily to the mental health profession. Let me explain. So obviously, if I had cancer, I have no way of figuring that out, let alone no way of understanding cancer enough to diagnose it in myself, right? Whereas when it comes to mental health diagnoses, I'm here to tell you, as someone that actually took forensics and got blasted by everyone around me when I would raise this reality, which is that a lot of diagnosing is subjective.
Yeah.
And boy, did the forensic psychologists not like it when I raised that idea.
Well, the DSM-4, every time they update it, people are like, that's not right. Like I just noticed.
But even still, like the things that are in there, it's not like with cancer, you take a sample and you put it under a microscope, it's cancer. With someone, where's the line between someone who qualifies for major depressive disorder versus someone who doesn't? And the criteria are, fairly subjective. You ask people how they feel, and it's a lot of self-report, which is biased in and of itself. But, when you're talking about borderline, for example, it's like the person reports feeling empty inside. Like, that's not a concrete thing. We people in our field like to think it's concrete. And boy, forensic psychologist people, they had a very elaborate way of it because, they literally get called on to the stand in a courtroom. And they have to defend all sorts of things, including their very profession. And so, whatever. But a very common ADHD diagnosis comes from a non-expert medical, like a family doctor will provide the diagnosis often. Not even a psychiatrist, or even if it is a psychiatrist, the psychiatrist spent 5 minutes with you or 15 minutes at the most. I mean, there are some good psychiatrists that actually spend the time. But a lot of these diagnoses will come with very little expertise and very little time. And so even if you did get a quote-unquote official diagnosis, especially if it's something like ADHD, but even if it's something easier to comprehend like depression, it's really on the client's shoulders to take the ball and run with it, to look up information about it, to keep track of their symptoms over time, to become very knowledgeable. Whereas if you had, say, cancer in your foot or something, you don't necessarily need to have any self-awareness. You could be diagnosed and treated and never think about it. As long as you just follow the doctor's orders and you just show up for your appointments, you could be cured without ever thinking about it. Now, I'm guessing a lot of people would. They would look up, but you don't have to. But with depression, with ADHD, you can't just show up, get a diagnosis, get treated, and walk away. Even if it is with medication, that almost never treats the whole thing. There are, I guess, some rare cases where you have very simple depression and you get on antidepressants and everything's fine, but that's very rare. Plus, there's side effects and blah blah blah. So the line between clinician diagnosing and self-diagnosis is blurred even when it is done ethically. So this notion of black and white, or this dichotomy, we need to have conversations really about how does the client and clinician or team of clinicians and the system around the client, how does everyone work together on assessing and diagnosing? You could have a spouse that goes to the clinician and says, here's what I'm seeing because it doesn't look like ADHD to me. Or you say it's not ADHD, but let me tell you what's going. And then the physician's like, oh, that is it. Because if you have ADHD, you might not have the wherewithal to notice that you're having, or other kinds of things. So it's really the best model is when you have access to services, which isn't always there. You have allocation of tax dollars so that clinicians can spend enough time. You have clinicians that holistically work with the client and the surrounding system. You have clients that have the privilege to look up information. They have access to good information, not the TikTok information or the RFK information, but actual good information. The clinician should actually point clients and patients in the right direction. And then everyone works together on the assessment, the diagnosis, and the treatment.
Yeah. Wouldn't that be a miracle?
So, side note.
Okay.
I looked up the information around the executive disorder It is an executive disorder. Thank you. That Donald Trump.
Thank you for diagnosing it as executive disorder.
Yeah. That an anonymous patient is referring to. It's the Ending Crime and Disorder on America's Streets. that Donald Trump proclaimed in July of 2025. So basically, it is an order that promotes placing individuals with severe mental health illness and also addiction into treatment facilities without their consent. So from the looks of it, it's like you're just going to round up people, but it's way more complicated than that. And I'm not supporting Donald Trump. He's an idiot. And I would hope most Republicans see that he's an idiot. I don't know. So an executive disorder is, he's not a dictator. We don't have that kind of a system. It's a matter of influence. It's a matter of suggesting to regulatory bodies or commanding regulatory or agencies, maybe to Congress, to allocate funds in a certain way. But in Seattle, for example, we have our own taxes, we have our own agencies, we have our own courts, we have our own prosecutors, our own police, and our own systems in place that has nothing to do with what Donald Trump says. It's influenced by it, potentially, maybe, but maybe not. Donald Trump says a lot of shit. And he doesn't
fund an actual system. He doesn't, none of these things are in place currently.
Right. So a lot of these executive orders are essentially his version of official tweets in a way. And if you actually talk to people on the ground, local politicians or agency workers that actually do this kind of work with people suffering from mental health that are on the streets, they will say what Donald Trump says is concerning. We'll see what Congress does and what funding looks like moving forward, but it changes nothing on the ground. It changes. We're autonomous as a state, as a city, as a county. We can do what we want, and the federal government can't do anything about that. So, depending on what your local municipality is like, will determine the concerns about being rounded up. But as far as I can tell, I don't even think I think Donald Trump made this executive order and then moved on to something else. So it's there, and RFK has his own kind of cobbled together weirdness. And then when RFK,
he's too busy swimming in sewage and talking about the worm in his brain to really make these things happen.
Now it is a thing and it shouldn't be ignored. But for myself, as someone with a mental health diagnosis, I, Kirk, have mental health diagnoses that are official, by the way, that are a matter of public, or not public record, but they're in my patient file that I don't have control over, right? I am not worried in the least about being rounded up into a camp. If there was some action taken along these lines, there is a system in place. We have a constitution, we have the checks and balances, we have states' rights. So I'm not particularly worried about this. Not to say we shouldn't pay attention to it, not to say we shouldn't speak out against it, but I don't think we should forego official diagnosing because we're worried that the next week the Gestapo is going to show up and round us up. My dog is scared, so I'm going to let her in. So talk to the listeners for a second.
There's the saddest, whimperingest noise. Hi, baby. We all just need a little love right now, I know. Hi, sweetie.
Well, it just started to thunder a little bit.
Oh, it did?
Or it didn't, but it's
big noises.
It's hailing. There's very small hail. I don't know. Do we call it hail when it's that small?
I don't know. Ice pellets?
Yeah,
Hi,
tiny little beads of ice for about 15 seconds occurred. That's the amount of weather we get in Seattle. And it's not even that cold out right now. So I don't understand. So because of that,
she got very scared.
Yeah, she gets afraid of the weather. So
come here.
Let's take a break. We get any closing words about RFK and Donald Trump and.
I just want to say that the news is awful and relentless, and I can see how we all get tweaked and think, how am I going to take care of myself in this constant hellscape?
All right, back from the break.
I almost choked to death, everyone, on a protein bar.
Yeah.
But I made it.
You had a protein bar. You almost needed CPR. And
literally inhaled
yeah,
a protein bar.
and I was mentioning, and I'll put it out there to the listeners, that as I get older, I find that I choke on food a lot more.
Eating gets more dangerous. Everything gets more dangerous. Somehow last night I tweaked my elbow in my sleep. I don't even know how you can do. I feel like all of a sudden I've got tennis elbow. I'm like, what did I do in the night?
Yeah. Do you sleep on your side?
No, part of this is that I did this workshop and I brought way too many supplies. And I think somehow bringing them in to the house last night got things aggravated. And then I did something extra in the night. Who knows what? Mm-hmm. And now it feels like I have tennis elbow.
Yeah. Yeah, sometimes I think that ailments and pains and aches just randomly occur. It's like we have a gremlin running around in our body.
Pulling things. Yeah. You don't need that tendon.
Yeah. And the way that I think about it, if there is a God, that God designed it so that by the time we're in our 70s, we're ready for this to be over.
Yeah.
And
are you watching the Olympics too?
Not really.
Okay. It's making me feel so old. So I've gotten obsessed with curling, and I just learned today that the stone is 40 pounds. So I'm like, first off, they're in this position that like my body can't even get in anymore. They're like a lynx on the ground, on the ice. And then they're pushing something that's 40 pounds. And then they're active with their brooms.
You'd be able to push these things. I mean, they make the ice specifically, like it's very special ice that they make.
Yes, I've seen with the they make it bumpy.
Yeah, they make it bumpy and then they shave it down and then...
And they paint it white. I didn't know that.
It makes it very, very slippery is the point. And along those lines, my sister, being from Minnesota...
Is she a curling person?
She's done curling. I think it's in their blood or something. But she slipped.
Oh, no.
And hit her head really hard. And she had a severe concussion where...
on the ice?
Yeah. Where sometime later in the hospital, every 3 minutes, her memory was being reset.
Oh, God.
So she would, every 3 minutes, just reset and tell my brother-in-law, her husband, why is my butt wet? Because when she fell on the ice and she was laying there, she got wet. She would say the same thing. She'd be like, oh, did I pee my pants? And then her husband, Cliff, would say, no, you fell and hit your head. And then my sister would go, oh, ha, 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 ha. And there would be this, she described the loop to me. And since then, which I think it was a couple of years ago, she's had, some noticeable memory issues. And I learned that with curling, you just wear regular shoes, right? So unless you have a lot of training, I guess,
you're going to slip.
I would recommend wearing a fucking helmet because there's nothing like slipping on ice.
Oh, no. I don't know if you remember this. This was like 3 years ago. It was super icy. I went through all this work to like turn a drain spout at my work so that in front of my work it just wasn't a sheet of ice, and I was freezing to death, and it was like so.
Wait, start over.
Okay.
At your work, what?
At my work, there's this one drain spout that goes right onto the sidewalk, and when it's freezing, it just makes the front like a sheet of ice.
So it would have to rain and then suddenly freeze,
right? Which happens here.
Yeah.
Or the snow is melting and it freezes. And so I did all this work to turn that drain spout so that it wasn't going onto the sidewalk. And I was like, was I stupid for doing that? Was that too much work? The next day, someone slipped and fell and died on the UW campus on the ice. And I was like, no, I did not make the wrong choice.
No. Yeah, it is treacherous. And people, I find, don't take it seriously enough. They'll be walking to their car and... oh, it's a little icy, and they think, well, I can handle it. It is very hard to manage your balance in a situation like that. So
you're supposed to walk like a penguin.
But even if you do that, it does not guarantee that you're not going to go down. And when you go down on ice, you essentially go head first, ass over tea kettle, right? That, the way that you fall, it's like a giant hammer, and your head is the head of the hammer. You just go, flat, or at the very least, you land flat on your back or your ass.
Yeah.
and you can really injure yourself. It's not like falling like if you were just to be on slippery grass or something, right? Ice is like very particular. And often, these are hard surfaces that you're worried about. So people...
Don't slip on ice. So are you a Amy Tan fan, the writer, famous American novelist?
Sounds familiar. Oh, well, you're talking about reading?
Yes.
I'm dyslexic, so
Okay.
I don't read anything.
So I am old enough that I've gotten looped in. Every January 1st, she writes a letter about how not to fall. And she lists how all of her friends have fallen in the last year, like friends that had fallen, and she tells the story. And then she has all these preventative acts, and one of which was never walk downstairs carrying anything.
Yeah.
Which is like completely impossible, but also like I thought was really funny.
No. So I have a broken back. I've had it since I was in high school and have flare-ups here and there. And my spine is all fucked up. I have it good. Like when I have been symptomatic, I've, talked to the experts and looked into it, because you just have this notion. It's like, well, if it comes to it, you have back surgery. And the fact is that for the most part, depending on the scenario, surgery on your back is a last resort, but the effectiveness rate is very low. And for some people, it makes it worse. Mm-hmm. So it is one of the worst things that can happen to you is to have a back injury, and obviously paralysis is horrible, but chronic back pain is, or just chronic pain, right? But chronic back pain being one of them can be life-ending, really, or at the very you can become suicidal from that kind of pain.
That's Luigi. That was his issue, right?
Right.
Back pain.
Right. Exactly. So with a lot of people, the injuries will occur just on, they'll fall off a ladder or they'll slip down the stairs, and they will be able-bodied people, and it doesn't take much. And in our house, we have a fair amount of stairs, and so I am very frequently reminding Stacy and reminding myself, because for me, the trip risk is because I'm wearing my flip-flops, my sandals, and I will catch my toe, as I'm going up the stairs, right? And although that's preferred to falling down the stairs, right, it still can be, you could still hurt yourself. And so every step I take, every move I make up the stairs, I tell myself, pick your foot up, don't get lazy with your feet. The other thing is I hold on to the handrail religiously.
Yeah. Well, and my house, it's 2 flights in and out, and I will look like an 80-year-old person walking out of my house. I will turn to the side and take one step. Like there's no rush.
Right.
There's no rush. And if this breaks, this is all I have. I have no other way to make money. So like I'm walking real slow.
Right. And you can literally die from falls. So please, people out there, be
careful,
intentional. And if it means taking 3 trips up and down the stairs for things you're carrying up and down the stairs so that you can hold on to the handrail, then that's what it fucking means. You know what I mean? Anyway. Annual long-term patron Kristen from New Jersey, she says, "Hi, Dr. Kirk and Rebecca. Rebecca, I wanted to thank you for bringing your authentic self and queerness to the show. Listening to you makes me feel like I'm chatting with my queer friends, and I love hearing your perspective and you representing queer culture. We are so much more than rainbow shirts, glitter, and carabiners. Although these things are fun.
Carabiners are very important.
Yeah.
I've got one in my pocket right now.
For what purpose?
With my keys on it.
Oh.
How do you have your keys?
Going on. Also, I consider myself a pretty raging feminist, and yet you really make me think about how I still have my own biases against women. I really appreciate that. We got to fight the patriarchy and can't do it if we're fighting internally. And Dr. Kirk, thank you for being a huge patriarchy fighter too. We need you. When you are doing an art therapy exercise with a client, Rebecca, I
just want to say to everyone, this is a topic change. When I first read this email, I was like, what?
Oh.
We go from one subject to a different, now we're on a different subject.
Yeah. When you are doing an art therapy exercise with a client, what are some things that you look for in their art? How do you process it with them? Do you look for trends over time, color, shape, line, shading, medium, etc.? The overall feeling, movement, emotions. I'm an amateur artist and was pondering this one day looking at my own art and had to write in to ask. Much love and thank you for all you do, Kristen. End of email. Smiley face. End of email. So, Rebecca, what do you look for in a client's art?
So I don't look for much, to be honest. It's really the first thing at the end of every in-session directive I'll say to a client is, how is that for you? So the most important thing is the client's experience of it. If you really want to know all the technicalities of what this patron just mentioned, you want to check out the book by the most prolific writer in art therapy, Kathy Melchiotti. She has a book called Understanding Children's Drawings, which will kind of break a lot of this stuff down. If it's some of the things that I look for is how much of the page the client used. Over time, if they're just using like the bottom half of the page or the top half of the page or the center part of the page, or they never fill the page, those kinds of things are interesting. And I'll point them out and ask for people's assessments of that for themselves. There's certain motifs in art that are associated with certain age ranges, but also if somebody has no artistic training after third grade, they're going to draw like a third grader. So I don't pathologize that.
Right. So it's the same to me as dream analysis. And you're going to see a lot of different things that are being said about dream analysis or about art analysis, so to speak, online or with clinicians. And historically in our field, there's been a lot of different practices and opinions. But in my opinion, the way to do it is the way you're doing it, Rebecca, which is that it's an opportunity for the client to explore something, and as their therapist, you know them, presumably well enough to be able to take some guesses as to what is happening with them, depending on the prompt, like I want you to write, draw about your childhood, right? Versus draw whatever you want. There's various different interventions.
Well, and I should say, like, I would never do something that broad. It would be like, draw me a bridge between where you are now and where you want to be. Okay. Because you want to give people something that's small enough that they can do in a session.
Yeah. But there are art therapy practices that are psychodynamic and very free associative, right? So the way that I think about it is that it is an opportunity for a conversation. And there's absolutely no way you can look at a piece of art, even with someone that you know pretty well, and say, this means that. Science doesn't support that. The experts don't say that, at least the experts that I respect. Now, is there research on certain things that you can know, like age development?
And it's pretty wild to see, like, what a person looks like. If you want to really have fun on the internet, like, look at the development of how a child draws a human being. Yeah. Like it's a circle with arms sticking out of it, and then like slowly all these things happen, and then most people's art development ends in 5th grade, so you won't get to these kind of later stages where things look very realistic. I had a really interesting experience. I taught my first workshop for Jennifer Sampson's
sex therapy?
Yeah, sex therapy. So it was tarot for sex therapy. And someone very strongly identified, I'm not an artist, at the beginning of the workshop. And I was like, well, I've stacked the deck so hard for you with amazing supplies that it doesn't matter that you're not an artist. And so at some point they're making art and they're very frustrated. And they had this picture of this famous person. And they're like, but I hate their face. And I was like, this is a collage workshop. Like you could, I just listed off like 10 ways that you could cover up that face. And they were like, oh. And they took my advice and they used it. But so there are ways that people get stuck that I will kind of like offer suggestions, but I'm completely unconnected to the final product for them. And there's kind of this wonderful self-discovery that happens when they're like, I made this, and here's the way that I would describe this. Or I do a lot, as people are so stressed out now, I'm just doing a lot of like introducing fun materials. Like my favorite Montessori store had a sale, and so I bought all these amazing, like really interesting stacking blocks that like stack, and they all have like 18 sides on them, or an extra big play scarf, to be seen in my latest ASMR video coming out soon.
Play scarf?
Yeah. So in
I remember you brought some to a podcast that we did.
Yeah. So in Waldorf, silk scarves are kind of used for everything, and I have a whole packet in my office. They shrink down pretty good. So I have this huge opportunity to play with all these different scarves.
Yeah.
And it's just, exploration is really, really important. There's all this research that it's like talking. If we talk through a problem, it takes us a certain amount of time. But if we problem solve through play, we get there so much faster. So that's
right.
what I'm working on.
So if I were to recommend something to Kristen, because it sounds like as you're making art, you're like, I wonder if there's something that I can do art therapy-esque on my own. And what I would say, as with dream self-analysis, is to either do an exercise for yourself, like a bridge from here to there, or I'm going to, as I think about my relationship with my spouse, I'm going to make something, art-wise. Or if you woke up from a dream and you write down as much as you can and try to fill in the gaps, as you're remembering it. And then once you have that, then you can reflect on it and say, like, what feelings was I having as I was doing it? What feelings do I have as I look at it? What might it relate to? Because that's the other thing with dream analysis and with art analysis, in my opinion, is that it can be a conversation between a clinician that cares about you and knows good questions to ask. That's the benefit of having a therapist, is that they don't analyze for you, but they have great questions that you wouldn't think of on your own. They don't have the answers, but they have the questions.
And there's such great books on this. So there's Pat Allen's Art as a Way of Knowing, and she also has a book called Art as a Spiritual Path. And then there's Matt Groening's best friend in college. Her name was totally spacing, but she has these books. The first one is called What Is This? And she has a series of 5 creative experiential books that will take you through this whole
and
process.
You have a workbook.
And I have a workbook. I have Squared the Circle. Also, the Vicarious Trauma Illustrated has tons of exercises.
But your workbook is a good example of that, of doing things on your own. Each page is its own exercise, and you follow the directive, and then there's a reflection part of it, right? And so that's how you do it.
And self-discovery is such a slow process. So like I have a client that just went through a severe depression, and we're so slowly putting the pieces together. Like this is a factor, and this is a factor over here, and is this a factor? And we're weeks into kind of, why did this happen now?
How does art relate to that?
I would say that self-discovery is a slow process, and you don't necessarily get it from doing a single thing.
Yeah.
Sometimes it takes a long time.
Yeah.
To be like, I always draw this weird figure.
And sometimes it's just that you just draw that weird figure. Like with me, my art is music, and I have every guitarist or musician has a line or a figure, so to speak, or a set of figures that they tend to fiddle in, certain licks or certain chords that when you just reflexively sit down at the piano and play something, this is the first thing, or the first set of things that you tend to just fiddle around with. And it doesn't necessarily mean anything. It could just be habit. The other thing that I'll say is that the conversation, so my area is dream analysis, so that's what I could talk about. That when a client brings a dream to me and I ask questions, and the questions I ask aren't arbitrary. They are from my own bias. I'm trying to intuit things, so it's not a complete blank canvas that I'm providing. So I have to be aware of that I can steer a client in a particular direction. So I want to be very careful about that because I don't want to influence how they see the dream. But if they get stuck in the exploration, then it might help for me to suggest, like, well, you talked about in the dream that you felt afraid of your teacher. Tell me more about that. For me to focus on that is a direction that I'm taking it. And what can happen is that the client can start to go, oh, you know what? I hadn't thought about that, but maybe it does have to do with my worries at work or something, or in my marriage, or my dad, or with myself. And then I might say, that is interesting because, last week you were telling me about this one thing. And then the client's like, oh, yeah. So then we go down this road, and then the client and I collaborate, but the client mainly concludes, oh, my dream had to do with my boss. That's the analysis. Well, how do we know that we're right? Well, we don't. But it doesn't really matter because it's meaningful to the client. And if I, as a therapist, observing this whole thing, because I always have one eye on outcomes and efficacy, that if the goal of therapy is potentially being moved towards, then we don't know. Maybe the client and I just naturally gravitated towards a made-up interpretation of the dream that actually assisted in the treatment, that felt right to the client. And I say all this because we have to understand the subjective nature of these explorations, but that doesn't mean that they're useless or that they don't have any basis to it. There's sort of a gray zone between like scientific, fact-based information and just making shit up. And if you're in a zone where you might be making up some stuff, but it's helpful and it's meaningful, it's sort of like there is no scientific factual basis on the meaning of life. There's no way to determine that. So, and yet I would recommend everyone find that meaning. And for me, my meaning and my purpose is a concrete thing. It is a firm, concrete, hard evidence thing, but I can't, back it up with any kind of scientific evidence. So having a dream analysis or art analysis where you gravitate or you find yourself going in a particular direction of analysis that feels meaningful, you can have clients, I'm guessing for you, Rebecca, that years later, I remember that one moment when I drew that one thing, and me and Rebecca, like we, explored that, and I discovered this thing about myself. Well, how do we know? Because people are often looking for those scientific answers.
Right.
Like, if I draw this, or if I have this dream, what does that mean? Well, there is no factual scientific basis to answer that question, but it doesn't mean that you can't explore and find meaning.
And the process of self-discovery is so long and interesting. A piece of art that I made, I think, is on your. Can you hand it to me? So like there are these metaphors that I've been playing with my entire life, like Neolithic god and goddess forms, butterflies, vases, text on pages, moons and planets, snakes, rabbits. Like, what am I up to? But like, I mean, if you look at my art now and my art when I was a child, it's so similar. I've just been chewing on these same things for, my entire life. And it gives me so much joy. So I always think of this friend of mine when I was early in my art therapy career. They said to me like, oh, you got to come like spy on my neighbor. She makes the craziest paintings. And I was like, there's no meaning for me in just looking at what she's made without watching her make it. And I was like, is she organized after she's done and she comes and talks to you? Oh, yeah. Then I'm like, it doesn't, like, there's this sense that like, oh, we'll release something and then we'll be something different, when really it's like, it's a very long process of self-discovery. Linda Berry is the name of the woman that has this series of creativity books that you'll probably get the most out of anything that you can ever look at on this subject.
So there's an email here that I think goes way back.
Okay.
I'm not sure, but I keep wanting to get to it, but let's go to long-term patron Mimi from Brisbane. She says,
Brisbane.
I mean, I think that's how you pronounce it. Brisbane.
Yeah.
Brisbane. My partner of 5 years has just abruptly left home without any warning signs leading up to this, other than the week before. My partner of 5 years just abruptly left home. He was getting burnt out from work and then left like he could not cope with responsibilities anymore. He has put himself in extensive therapy since then. He won't come home until he feels mentally better. He says that he is having an identity crisis and that he is completely numb emotionally. I have spoken to my friends. 60% of them have said that their partners have gone through this mental health crisis as well. We are all in our 30s. The pattern appears to be triggered by extreme burnout. This seems quite common, but a major issue that everyone sweeps under the rug. Would you happen to know about this crisis? Is this a new thing that the pandemic has brought us, or have we been sweeping this under the rug for ages? What do you think?
It used to be called a midlife crisis. I think people are working harder, and probably the pandemic pushed it earlier. Now it's like a 1/3 life crisis. But yeah, I wouldn't say like this is I see this in my practice all the time. So sometimes I feel like in our work, we're exposed to things that people are like, does this ever happen? I'm like, oh yeah, this happens. So yeah, people reach the max and they don't take care of themselves along the way, or they can't, or something hormonal or environmental or, governmental incompetency pushes them over the edge and they run away from home. I mean, there's so much documentation of this, of people just taking off from their families, like throughout time. Yeah. People just are done and they leave. It's one of the things that happens. It's really messed up and scary if you're on the other end of it.
Yeah, I would imagine for Mimi in Brisbane, this would be scary. It's like, well, I care about my husband. I hope he's okay. But what does this mean about our marriage? Like what's going on?
I would, my stepfather did this. He called from New York and was like, I'm in bed with my lover. And, he said to my mom, our marriage is over. I'm not coming home.
Right. So that's the other thing I want to say is that this is nothing new. And the way it would manifest in the past would be, in all likelihood, more dysfunctional. There would be an affair or something. What Mimi is talking about is that her partner is going to a mental health institution, right?
Or at least getting a lot of therapy.
Yeah, he's getting a lot of therapy. It sounds like maybe he is, well, she didn't say where he went, maybe like to family or something, is my guess. Anyway, and in today's world, you're more likely to find someone actually have the wherewithal or the access to these other methods. But in the past, it would be like an affair or just disappearing, or you can escape into alcoholism, drugs.
I think the tale of the Odyssey is this, right? He leaves for 20 years. Like, just come home.
Yeah. Yeah. And I'm not the first person to say this, but, PTSD and the toll of war on someone, right? So, it's not a new thing that humans will be in situations or cultures where they deny their feelings and it builds up and then they have to. So what happens is that there's a buildup of emotion and stress that the person is either ignoring and or trying to manage, and they're not being effective with it. And then it becomes to such a crescendo that they might actually start thinking about killing themselves or doing something drastic.
I listened to the podcast that you did on Nuremberg trials, and I learned a lot. And I thought that was the story about that psychologist, his wife saying, like, you need help, and him saying, no one would trust a psychologist that saw a psychologist. And then he killed himself.
Right. Yeah. And that was a psychiatrist who wouldn't go to see a psychiatrist. But that was in the past when that was more prevalent. It still is, but it was more so in the past. Yeah, interesting conversation with that guy.
Really enjoyed it. And that moment where you realized that the Holocaust camps were everywhere.
Yeah.
I was like, oh shit, that's so interesting. That's something I've always known.
There were like thousands.
Yeah, it was, yeah. Yeah. I mean, this idea, and then that started a conversation with me and my friend where she was like, how did this work? And I was like, if you tell one group of people that's desperate to feel superior that another group of people is basically animals, they have no problem living next to a facility that destroys what they just see as animals. They don't see them as people.
Yeah.
But it brought up a whole conversation with a client of mine where we actually physically looked at the map in the session and thought about it. So yeah, sadly, patron, this is not uncommon. People change drastically and sometimes they don't come back.
Yeah. Yeah. And Mimi, it might have nothing to do with you,
Yeah.
and there might not have
personally.
been anything you could have done. It might affect your marriage, who knows, or your relationship, who knows. There might be some fallout that does affect you. There might not be. Maybe this is what he needs. This reminds me of something that I learned way back about mental health practices in Japan. And this is a very complicated topic, of course. There's millions of people and lots of different practices, and there's a lot of history. But one of the practices that emerged as mental health began to be kind of recognized was this practice of people having burnout from their life, from work, from family life and stress, and they would go to their doctor or something, and then their doctor would recommend this treatment protocol where they go to essentially kind of like a meditation center, but It's not a meditation center.
Get thee to a nunnery.
Yeah, it's just a quiet room that you stay in, and the clinician comes in for 5 minutes in the morning every day. And you don't have a TV, you don't have any books. I mean, maybe there's a book or two or something, but you don't have any TV, you can't talk to anyone, no one visits you. And the idea is that with complete isolation from stimulation and from pressure, then the mind can recover or perspective can occur or something. And the individuals will stay in these rooms for a week, and a lot of people would find it to be effective. On the other side, it's just like ignoring people with their problems and, putting them in the tank, essentially, essentially like isolation in a prison or something. But it is very Japanese, if you understand Japanese culture, to do something like this. And it can work. And we can all think about this for ourselves. And a lot of us do this, right? You'll take a vacation from work and you won't open your laptop the whole week, or you will, go somewhere where you can't be reached by your phone. People will do this on purpose. And it's very important that we have these measures, even if you don't consider your life that stressful, because in all likelihood, there's a low buzz of stress that's happening, particularly if you spend any time on doom scrolling and social media and that sort of thing. Didn't you specialize in this kind of work, burnout?
Well, vicarious trauma is an aspect
Right.
of this. Yeah, I have all kinds of exercises to help people address burnout. It's there's all kinds of protocols for it, and I have a whole presentation that I do this. I think it's coming up in March at Cascadia. That I'll always like, hey, there's this protocol. Anyone ever see it? And all these mental health clinicians are like, no, I've never seen it. I mean,
lay it on us.
So it's this 9-question. Oh my God, I can see her name, but I can't say it. So it's the one that's most effective is a narrative therapy based. It's in my book, Vicarious Trauma Illustrated, along with lots of other protocols. But it just goes through these 9 questions of like, how has working at this job impacted your views about the world? And you just give people time to talk about that for as long as they need. And then there's 7 other questions in the middle, and then it ends with, how has working at this job impacted your relationship to your body? And it's just really interesting if you let people just kind of talk the way through how workplace stress has impacted so many aspects of their life. It's usually, I would say, every time I do this protocol, people are talkative of at least 7. There's always 1 or 2 that people are like, hasn't done anything. But yeah, we work incredibly stressful jobs. Most people, I don't know what it's like in Australia, but you never turn your phone off. Like you're always on in some capacity. Or I even think of watching you in the last few years where you're like, I don't do Facebook anymore for the podcast. I mean, people on the Instagram contact me all the time. Where's Kirk's Instagram? And I'm like, he got off. He was done. So, we're all doing these things of like, how can I stay sane in this time? Like I've just spent so much money on adaptive aids for my neck. Like I finally caved and bought like the special memory foam pillow, and I bought like another neck wrap thing so I can have one at home and one at work. And like, if you look around my life, it's covered in all of these like neck supporting devices.
Well, that one woman who is in charge of the "we don't give a damn."
Oh yes, she's got her neck roll thing on. Yeah, I mean, the amount of coping and self-care.
Or "we just don't care anymore."
No, that We Don't Care Club.
We Don't Care Club.
Melanie.
Yeah.
But it's easier to get
I
burnout
can imagine
than you realize.
I can imagine that exercise being powerful.
It is. I love giving it. I have to tell clients, like, we're going to spend a whole hour on this.
Yeah.
You're really going to talk it out. Because we don't give ourselves that much time to reflect. And oftentimes people don't realize, like, oh, I think the world is shit because of the work I do.
Final word, Rebecca, on today's episode.
Oh, gosh. Please take care of yourself. It's so rough out there. We're all just so, frayed pieces of... It's like those flags that you see when someone needed to take that flag down a long time ago and they haven't, and it's like all tattered, but it's still hanging up. That's what...
Let's talk about something fun. In 10 seconds, your favorite part of the Super Bowl halftime show.
Oh, my God. Ricky Martin, for sure.
Which I didn't even recognize him.
So I had heard that there was going to be like some kind of gay Puerto Rican moment.
Well, there were two guys making out.
Right. That was kind of fun, but like Ricky Martin was at a whole nother level. So there was all these names being bantered about of like, he'll have this artist, he'll have that artist on. But then he had Ricky Martin on, which is like, ugh, my heart just breaks. It was so beautiful. He's so silver fox right now.
Is he?
Yeah. What was your favorite moment?
My favorite moment was the two gay guys, because I thought I was watching them get one over on the broadcast. I mean, I don't know if the broadcast knew that was going to happen. Mm-hmm. But it doesn't seem like the sort of thing that the NFL or the network would get behind, Mm-hmm. So when it happened, I actually, with Stacey, I like, wait, did I just see? And then I paused it, and Stacey didn't catch it, and I rewound. I'm like, look. And Stacey seemed completely unimpressed by it, but I was like, that, it's 2026, so that shouldn't be a thing. Mm-hmm. But I'm like, I'm pretty sure they just got one over. I don't think that was on the agenda. Mm-hmm. That was Bad Bunny and his people saying, okay, let's sneak this in there. You know what I mean? That was my favorite moment. Stick it to the man kind of a thing.
Yeah, it was joyous. It was wonderful.
Yeah.
Made me very happy.
And everyone out there, please take care of yourself because...
we like you.